ako o makata me ni wegbe ano twa ni omani aba twa ni omani juno aba efi o ma kan mene mi shegbini mene zaina tv ishabiye ame bani gamumu ame bana me kema bana yemu ke chomu ke shinawu eya fo ni minto make oblanta na memba eche election year ni minto make nya gekechin ke o no ya vote no bashia no bawo ni ka to asi sokoro ke no juku no abotui ni panye fai oblanta na me ba ni panye fai ne ka ani mu ko hanya shika ne ka ombre Ghana wonyede ne ba hanya shika ke klanti ne ya nye kenye ya no anemi kan kite nye kenye ya no me ni ga mu tonjen mba jeme no wo belig can you only kaka wo tonwa because we can hear TV no we can hear radio no we hankuri yayi na maza da mata we hankuri ni na ku ni ga mu nike magana wo na daya da zan ga muku matasai abokanai na yan waye na yanzu election yazo kuma election yazo ka san mun yanzu gomu ake use an jusu mu da kyau kuma an ba mu kudi kankani je ka fada don gan je ka fada don Allah don annabi ka kai don girma ya rasulullah ka kai don ka je kai in ya baro an zuwa kira mu aka zuwa ka kira mu ban zuwa in ka je za ka vote da safin ka tashi ka sa nose mask kan mai lafiya saboda yawan mutane ka sa nose mask ka da covid-19 ya zo saboda shi muna gudun ciwon sai ka je ka vote in ka je ka sa kuriyan sai ka zo gida yan waye ne abin da nake da shi message da nake da shi da zan gaya muku kenan ku yi hankuri an yi me ismoloye min kpanye faye kanye tenye avoto na ne covid-19 ba wọ́n fẹ́ wọ́n ṣe gbélégbéye gbẹ́kẹ̀ ń ṣe gbélégbéye onípa ń ṣe gbélégbéye inú mọ̀ ń ṣe gbélégbéye ní ọkọ̀ ìyá àtàwọn ọmọ nose mask fine ní òkè wo ogúngan ní ó yá kéèmù kò ń tí bòpó káfọ̀ mọ́ ọ̀dà bóyá dómọ́ láìmí kàtàbí ní ìbá ṣe ẹnu ní àfọ̀ chíkì yẹ kó fọ̀ chíkì ọ̀tàn ní ó bá ṣe àná ó bá wọ̀ ànàmí mi ń sùnmọ̀ lọ ẹ̀ ta ní òmà ní jùlọ abúlá o ta ní òmà ní jùlọ abá.
Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Ni ne naku Zarmai Bonkwai no 1 Alhaji Tanko, Sarkin Zabarmawan Greater Accra, kuma President Coalition of Zabarma Chiefs, kuma President Ghana Zabarma Association. Yau na zo muku gidajenku, na muku sallama na Islama. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Lokaci ya zo kuma da ya kamata mu je mu jefa kuriyan ga da za mu jefa muna roƙonku jama'a musulmai baki daya ko ina kake bangaren duniya ma kana saurara na da kake da vote Ghana muna roƙonka in ka je ka vote ka bar wurin saboda lokaci ya kai da ba mu son abin da zai kawo muna bacin suna kuma za mu son abin da zai kawo muna tashin hankali. Ka je gida ka jira electoral commission za su kawo maka jawabin abin da ya faru daga wurin nan kuma za ka muna roƙonka kaka sa wani riga da ke nunawa ka fito wanga kungiya ko wanga kungiya na party. Banda wannan kuma shekara ya kai da ubangiji Allah ya jarabce mu da ciwon da ake cewa coronavirus covid-19 ga yana tare da mu hawa yau shi sa in za ka je yi kokari ka sa nose mask ka da zai nunawa cewa kaman kana kare kanka da kanka. muna gode muku da kuka saurare mu, kuma Allah ya tabbatar, Allah ya sa mu kare wanga zaba cikin lafiya. Kuna kallon mu ne kan Baina TV. Baina TV, connecting to the world.
Good evening, viewers. Welcome to your #1 health show, Health Zone, on Baina TV. As you all know, this is season 2 of our recordings, and season 1 was full of interesting topics, interesting guests, interesting discussions, and very interactive. We covered hypertension, diabetes, back pain, lupus, glaucoma, prostate cancer, neonatal jaundice, peptic ulcer, typhoid fever, urinary tract infections, and we ended with stroke. Welcome to season 2. This evening, our discussion is on uterine fibroids. I have with me PA Fatima to Madina Muhammad. This is her second appearance. Her first appearance, she did urinary tract infections, and it was simply amazing. Welcome. Once again, we are discussing uterine fibroids. Salaam alaikum jama'a, ni ne naku Rabi Mahmud Watigi. Mun kawo muku Health Zone kuma wanga season 2 ne. Na farko mun yi conditions daban-daban. Mun zo kuma za mu kara bayani kan abubuwan da ke damun mu. Hajiya Fatima binta Madina Muhammad ke cikin gidan yanzu. Welcome once again.
Thank you.
Okay. To go straight to the point, what are uterine fibroids?
Okay. Uterine fibroids. Okay, before I start, I would like to briefly talk about tumors.
Okay.
Yeah, tumors are just growth, abnormal growths in some of the organs of the body. It can occur in any organ. But then when we talk about uterine fibroids, this type of tumors only grow in the uterine wall or in the reproductive system of the female. And they are usually not cancerous. So that's what we mean by they are benign.
Yeah, they are benign.
They are not cancerous. And they occur in women who are in their reproductive age.
Oh, okay.
So it's a very common thing among the women of reproductive age.
Okay. So are there various types or different types of fibroids out there, or is just a straight-jacketed one type of thing?
Okay, uterine fibroids are categorized based on their location, or they are classified based on their location on the uterine wall. And when we talk about the uterine or the uterus, it's just the womb, what the layman would term as the womb. It's the structure that carries the fetus or the baby during pregnancy.
Okay.
So the uterine fibroids, depending on their location on the uterus, then we are able to differentiate them into 3 types.
Okay.
So we have the submucosal, that is the one that occurs in the endometrial lining or just below the endometrial lining. So they grow just at the endometrial lining in the uterus.
Okay.
And then we have the intramural. The intramural grows in the muzzle, in between the muzzles of the uterus. And then we have the subserosal, and that one grows outside the uterus. Outside the uterus, meaning that though it attaches itself to the uterine wall, the growth extends outside. It doesn't extend into the uterine wall.
Yeah.
So those are basically the three classifications of uterine fibroids.
Okay, thank you very much. So, Jama Maranjinga, Muda Haja Fatima, Muna Batum, uterine fibroids. I mean, the Mudu Kamuki Chema fibroid. Not a bit of 1 hour, Waki Chema, fibroids, school uterine fibroids, the Muka Saninga. Chicken Bayani type got uterine fibroids, 1 hour, the case, Uayaki Apua, Jikin Machi, the wooden reproductive area, wooden iPhone. Tawurin mahaifan nan inda dai komi da ke jikin mace da ke relate to haifuwa wurin na wannan area nan ne kuma ta gwada kaman wai wani abu ne kaman tumor wasu abubuwa ne da ke iya suke grow jikin mutum suke girma yana iya fara kankani ya zo ya fara girma jikin mutum amma irin wangan nan ba kaman yana da kaman yadda ake cewa kaman cancer nan bane yana grow all right but bai da cancerous kaman bai da too dangerous kamar yadda cancer sai ke ko that's it sa tumor kenan irin wannan ke zuwa ya shiga cikin reproductive system mace ta wurin maranta ko ya da a wurin mahaifan nan yake cause irin wannan problem to ta ce wai akwai shi daban-daban kuma dukansu sunansu na depend on location inda abin zai je ya kwanta akwai submucosal shi akwai intramural da subserosal dukansu based on inda suke kwantawa cikin mahaifan da ke gwadawa sunan da ake ba su isa takaice batun uterine fibroids kenan. Dr. Fatima, what predisposes someone to getting uterine fibroids?
Okay, the risk factors or what predisposes someone to uterine fibroids are basically age.
Okay.
And when I say age, I mean a female between her time of menarche to her time of menopause.
Okay.
So anyone within that age range is liable to developing uterine fibroid. If there's any family history of uterine fibroid, that's if the mother or a sister has a uterine fibroid, one is also predisposed to that.
Okay.
Then we talk about obesity. That's when an individual, a woman is overly obese.
Yeah.
That is when there is overweight.
Yeah.
Yes. So that also predisposes the person to uterine fibroid. And someone who has never conceived also predisposes the person to developing uterine fibroid. And even vitamin D deficiency also predisposes one to development of uterine fibroid. Sometimes even some foods such as white bread, white rice, cookies, cakes, all those things predisposes an individual or a woman to development of uterine fibroid.
Oh, okay. A quick follow-up question.
Okay.
Based on what you just said, lack of conception as a possible predisposing factor. What might be the cause of that?
Yeah, for this one, I would say, you know, when the fibroids are growing or when they are developing, when there is a fetus in the uterus, you know, as the fetus is growing, it competes with blood supply with the fibroid. So when the woman is not able to conceive, then the fibroids are disposed to enough nutrients, enough blood flow.
They have just the environment to grow. The perfect environment.
Yes, there's no
interruptions.
There's no interruption. So that also predisposes most of them to uterine fibroid.
Oh, okay. Na tambaya wani abubuwa ke iya bar mutum ta samu mace ta samu uterine fibroids din shi ne Dr. Fatima ke gwada wai daban-daban ne. Na farko ne aging mace. A ce wurin girma da muka ce aging mace ta fara girma. To wurin girman ga ta bayar menarche to menopause. Tankan tun lokacin da mace da ta fara haila har lokacin da hailan zai zo ya yanke cikin girmanta. Tun wannan period nan duka har zuwa wurin yankewan mai shi ya samu uterine fibroids. Takan budurwa na iya ta samu babban mace kuma na iya ta samu a takaice explanation da ta bamu kenan. Family history in dai cikin zuriyanku akwai waɗansu ke da shi, balle maybe kina nan ummanki ta samu fibroids, yana da possible kamar ke kuma kinya ki zo ki samu fibroid. Obesity, yawan jiki, so da yawa muna da matan mu da yawa da jiki, muna da jiki, yawan jiki so da yawa yana iya predispose, yana bar wanga abin ga ya fara yana develop. With lack of conception, inda mace ta zauna so many years maybe ba haifuwa, wurin mahaifan nan she wurin ne yazo yayi kaman space ya zo wurin. Abin ga fibroids dai fara in dai ya riga ya shiga wurin nan, don ba wani yaro da ke kwantawa wurin, ba wani problem da ke zai zo wurin ya zai ya ture shi ma ya yar, ko wani ya zai ya dame shi, yana samun hanya ya samu blood supply, nutrients komi da abin da ni yaro ya kwanta wurin dai samu ya yi fine. Sai shi fibroid ne zai ya kwanta wurin ne ya enjoy wannan abubuwan nan, sai ya bar yana girma. Yasa so da yawa mace da ba ta samu ba ta da haifuwa tana kan samu uterine fibroids ga. Sannan wai vitamin D deficiency, vitamin D da muke sani, vitamins da muke fadi wanga, in ka zo kana lakin shi yana ya kawo. Sannan ta kuma fadi about some foods da muke ci, like
White bread.
Yeah.
The white rice.
Yes, some common foods da muke ci so da yawa yana iya cause mana
because they have some
abubuwa kenan.
additives that
Yeah, the
causes.
additives that are added to the foods
Yes.
go a long way to cause some of these things.
Yeah.
So a takaice bayanin da ta bamu kenan. Sai na tambaya kuma, okay, we talked about the category of women. I want to do the category of women. You said from menarche to
That
menopause. So it means it cuts across from someone as young as probably 15
Yes.
to someone as old as probably 60.
Okay. With that, I think I'll have to throw more light.
Yeah.
on it.
Because the menopause varies from person to person.
Yes.
Some start at around 40.
Yes.
Some will be 45, 50.
Yeah.
Some go as long as 60. Yeah.
So with uterine fibroid, it's common in about 50 to 60% of women. But then the commonness or the age group that are actually easily disposed to or develops uterine fibroid are those who are between the age of 35 years to 49 years.
Okay.
On average.
On average.
So depending on the person's menopausal age, when the menopause started. Yeah, averagely between 35 to 49 years, they are at a higher risk of.
Okay.
So uterine fibroid is usually very, very common
risk.
in those patients, even though it occurs from menarche to menopause.
Okay.
But this category
on the
of
average,
women, yeah,
on the average, wai on the average, inda aka ce an cire duka ta sakankani da a dai ce matan da suka ci kaman shekara kaman 35 years zuwa 49 years su suka fi samun uterine fibroids nan. Isa ta clear muna. Ana iya same shi from menstruation to menopause. Amma a takaice dai cikin wannan age group nan from 35 to 49 nan su suka fi samun uterine fibroids. Okay, Dr. Fatima, what are the signs and symptoms? Are there any signs and symptoms that one observes or the feeling that you get when you have fibroids?
Okay, you know, sometimes they can be asymptomatic. When I say asymptomatic, they may not show any sign or any symptom at all. That would depend on maybe the development of the uterine fibroid, whether they are very small or they have really grown to a stage where they are causing a lot of pain, where it becomes symptomatic. Some of them can live with uterine fibroid without even knowing it because they don't present with any signs or symptoms. But some too do present with the signs and symptoms, and I think that depends on the size of and even the location of the fibroid. So the common signs and symptoms are usually they have lower abdominal pain, they have these pelvic pressures, they have abdominal distension, they have this frequency in urination. The frequency in urination occurs when the uterine fibroid grows so large enough to press against the bladder, because the bladder lies above the uterus. So if the fibroid is huge enough, it's able to press against the bladder, and it causes frequent urination. Yes, and also some of them do also develop constipation, because when the fibroid occurs, especially the subserosal, the one that occurs outside of the uterus, they sometimes grow and they extend into the abdomen. So they end up compressing some of the intestines, causing constipation. So there is no easy flow of fecal matter from the intestines outside. So these are some of the signs and symptoms that they present with, and they usually come with heavy bleeding, when especially the fibroid is occurring in the submucosa. And the submucosa has to do with the endometrial lining, which usually wears off when a woman is menstruating. So if they are occurring at that particular site of the uterus, then when it's time for the person to ovulate, it's when it's time for the person to menstruate, you know, the endometrial lining sheds off, causing bleeding. So if the fibroid is located there, then there will be a rupture of so many blood vessels. So that causes heavy bleeding or even prolonged bleeding as well. The person who usually has her menstrual cycle, maybe just ending within 3 to 4 days, will end up extending to 7 days or even more. And the bleeding becomes also very heavy. So these are some of the signs and symptoms. And they also present with anemia due to the heavy bleeding. Yeah, so they end up losing a lot of blood and as well as body fluids. So those are basically the commonest signs and symptoms of someone presenting with uterine fibroid. So they have an abdominal distension as well.
Yeah, you mentioned.
You mentioned.
Yeah. Okay, so jama'a na tambaya isa an haka ce mace ta samu fibroid, uterine fibroid singa. Wani abubuwa ke iya afku me zai bar mai shi ya gane kaman wani abu haka na tafiya. So sai dawa ciwo da yawa na yana baka signs da symptoms da ke bar ka gane kaman maybe wani abu haka samu mace na da shi ya za ta yi ta gane. Shi ne ta ce wai na farko asymptomatic. Waɗansu na nan suna da shi sun yawo da shi kuma baka ganin kowane sign ba abin da ke gwadawa. Nothing. You don't get any symptom at all. Sai ta zo kuma ta ce lower abdominal pain yana cause ciwon mara. Mai shi ya saura yana ta samun ciwon mara. Frequency in urination don abin na girma ne yana compress kan abin bowling muna ce mai bladder yana compress kan shi sai yana matse shi sai yana bar mai shi na boli guntu very often. Sannan abdominal distension don abin na girma yana nan da girman shi nan yasa yana iya bar tumbin mai shi ya look kamar yayi girma. In ka kada kin ga mutum kin santa kamar tumbinta na da flat kuma ba ciki take da shi ba, amma kafin ki ga ki ga tumbin mai shi na girma kuma mai shi bai da ciki. Fibroids yana iya cause wannan abu, yana iya cause constipation kuma. Constipation mai ma'ana rashin zuwa gida. Maybe kullum ka tashi kana iya kaje ko wani rana yau baka je ba, perhaps gobe ka je kai ka zauna kwana 3 kwana 4 baka je ba because of that. So in ya fara girman nan shi kuma yana put pressure one particular type in shi submucosal subserosal yana cause pressure, yana iya bar ya cause pressure on the intestines and shi ya block hanyar bayan gidan da ke wuce wannan sa yana cause wannan abu. Sannan kuma yana iya bar jini ya fito da yawa mace heavy bleeding take ce mai, kuma yana iya bar yayi bleeding nan kuma yayi extended don girman formation shi yana bar jijiyoyi kanana na rupture in the process. Sai yana bar bleeding na zuwa wurin mace nan. To wani bi kuma maybe mace na haila kwana 4 kwana 5 yana ya fi kwana 7 abin na zuwa because of the presence of fibroids and then extended bleeding. Na karshe sai ta ce kuma wai me don extended bleeding nan don jinin da ke zuwa ya dade ne sai ka zo kuma baka da jini sai ka end up with anemia. Those are the signs and symptoms. Thank you very much. Da karshe shi kenan signs and symptoms. Zan tambaye ta follow up question. Are fibroids treatable?
Yes, they are treatable.
What are the treatment options?
Okay, there are different categories of treatment options. We have the watchful waiting, which is one. We have the medications, and then we have some of the surgical procedures. So with the watchful waiting, it usually occurs, that one is done on patients who are not probably um, pregnant, and also the growth is very slow. So some of them are so extremely small that you don't need surgery to remove them. You don't need any medication. So you just keep waiting and then watching how they grow, whether they grow faster or the growth is very slow. Then they can. There is no. It's not necessary for them to even be taken out since they are not causing any harm to the individual. And then also um, with the medications, with usually what is given is oral contraceptives.
Okay.
Because what facilitates the growth of the fibroid is the sex hormones, and then reproductive hormones, that's the estrogen and then the progesterone. So if there is an increased estrogen or increased progesterone, it causes growth of the uterine fibroid. So the medications, they are giving what we call gonadotropin releasing hormones. Yeah. So that also aids in managing the fibroids. Then they are also giving progestin. Progestin is also given to help shrink them. So progestin actually shrinks them and puts the individual in a menopausal state.
Okay, so that is when it comes to the ones that are not too big,
the ones
that are not big enough to be touched.
Yes, and even sometimes when they are extremely big and there are options.
Okay.
Yeah, they are just treatment options.
Yeah.
So if any one of them that is being used, depending on whether the size of the fibroid is big enough or it's even smaller, the progestin, what it does is that it's able to shrink it, put the individual in a menopausal state where you are not able to produce enough estrogen to facilitate their growth. So sometimes to the extent they even disappear with the progestin. And also oral contraceptives, as I mentioned, most of the oral contraceptives are also used. Then with the surgical procedures, hysterectomy can be done, myomectomy could be done, laparoscopy can be done. Laparoscopy is when the abdomen has to be opened and then the fibroids are removed. Probably maybe there are so many that you cannot use other procedures. And also there's another procedure that is not really invasive. With that one, if the fibroid is, if there are not so many and the growth keeps increasing, or the fibroid is so huge enough that you need to actually shrink it, or you don't want to use any invasive procedure, what is done is the embolic agents are injected into the artery, the blood supply to that particular organ, that's the uterus. So if the artery is blocked, then there is less blood supply to the uterus, and that also cuts down the growth of the fibroids.
Okay, thank you very much. Can you give us a quick recap on what all that you just said in local language?
In the local language. Okay. With the local language, you know, we are just
I know we all managed here. Keep trying.
Okay, so treatment.
Now it's but between as hospital the fibroids. Abubuwan da ake yi mami shi ya samu sauki. Shi ne a turance ta gwada muna abubuwan da ake yi. Amma na ce mata ta zo kuma a Hausance mu ga cikin abin da muke.
Okay, treatment in fibroid, and I treat fibroid. Yeah. The good thing about it is that it is not cancerous, but cancer bane. Wani abu ne da yake girma cikin mahaifan mace. So ana iya maybe wani lokaci in bai da girma, ko maybe bai nan ga affecting ne shi, ko kuwa maybe ba mai ciki bane da a ce fibroid nan na distract the growth of a girman baby nan ba, ana iya maybe a bar shi a yi ta observe constantly. So
Aka
that's what we
duban
call
me
the
shi
watchful
waiting.
Yeah, ana yana duban like ko girman shi nan ya dami me shi ko dai ya yake girma, if it's really growing faster or not. So that's what we call the watchful waiting. And then wani lokaci kuma muna yawan use magani.
Magunguna ba.
Magungunan nan kaman contraceptive pills da akwai wanda ake ba wanda take da fibroid. In tana shan duka ina rage girman fibroid nan. Akwai kuma hormones. Wannan hormones nan ina nan tare da mu, amma wani lokaci in yana da yawa ko bai da yawa ko in yana support girman fibroid nan duka, akwai wanda ake yi a ba mishi artificial one.
Ya so ya tanye body na
Yes. So then sannan kuma other treatment nan ne surgery. Surgery na ba wani abin tsoro ba ne. So da yawa aka ce ma mutane mu da yi surgery ko da yi operation shi ki ga mai shi na gan kamar.
Sada dai je ne a bude a cire fibroids na kuma kulle ba wani surgery mai ban tsoro ba ne.
Ba wani abin ban tsoro ba ne. So that's basically about
to Hajiya Fatima mun gode kwarai. But as a follow-up question to these treatment options you've given, there is a myth out there that apart from these straightforward treatment options we have medically, there are forms of shrinking these fibroids using various forms of medications we are not too certain about. What do you have to say on that? What's your take?
Okay, from my point of view, because we have, as I mentioned, progestin already, which is able to shrink it. Yes, fibroids are being shrink. They can be shrink. They can even disappear. And maybe there will be just a different growth, but not necessarily the one that has already been shrink. Yes. But then using other maybe homemade or herbal medication, I can't really say anything about that because I'm not sure. But I'm aware of the hormones that we use for shrinking the fibroids.
Oh, okay.
Yeah.
Oh, okay.
So fibroids can really be shrinked and they disappear.
Oh, okay.
But as to whether herbal medications are being used or homemade stuff,
there's nothing much you can say. There's nothing much you can say about that. Do fibroids reoccur?
Yeah, they do reoccur.
How often do they reoccur?
They do reoccur if the predisposition factors or the risk factors are still in that individual.
Okay.
Sometimes too, even after hysterectomy, even after maybe removing the whole womb, they can still reoccur. Maybe they had already started forming in a part of the reproductive organ that the surgeon or the individual is not aware of. So then that too can regrow.
So that one grows and then it becomes another problem to deal with.
Yes, and even after myomectomy, that's removal of only the fibroids from the uterine wall, they can still regrow again. So the possibility of them reoccurring is there. But then as to how quick or how often it reoccurs is not a fact I can throw so much light on. So far as the predisposition factors
are still there,
the probability of it reoccurring is very high.
Okay, to jama'a na tambaya Hajiya Fatima. Fibroids yana iya zuwa ce mutum ya samu fibroid an je an yi operation kuma ya kuma komo sai ta ce wai abinda ke afkuwa ne don sai da yawa factors da ya bar ya zo nan maybe wannan abubuwan nan bai je ba yana nan kuma yana iya afku kamar abin na wurin an zo an yi surgery an kare maybe wani kuma ya fara girma wani wuri daban da wannan lokacin bai kai lokacin gani ba isa ba gani ba isa aka riga aka yi wanga surgery aka kare daga baya sha ga kamar wani kuma na grow isa fibroids yana reoccur. Sai na tambaye ta one very important thing don true explanation da ta bamu na magungunan da ake bayar hospital na yana shrink fibroids tankan yana bar girman shi nan ya rage. Sai na ce mata waje ba batun hospital ba mutanen da muka sani waje ana cewa wai akwai magunguna ana shan wani maganin baki da abubuwa da ke shrink fibroids. Sai ta ce wai wannan dai ba abin da za ta faɗi da jikin shi match don ta wannan hanya ba farnin ta bane ba area ta bane amma tun da dai maganin bature na yayi maybe wannan dai ta ce kamar gaskiya ne ana yi ya zo kasa amma in dai use wannan magungunan ne ba abin da za ta faɗi da jikin wannan wai don ba area ta bane maybe ta wata faɗi wani abu.
Maybe the probability that the herbal medications can induce the effect
of those hormones that are given at the hospitals.
So if they can actually induce those effects, then it can probably lead to shrinking the fibroid using herbal medication. But to be specific as to this herbal medication or how true it is, I can't really say much, but just that it can also affect. It can also have the same effect as the
it may also have if it contains those hormones, the contents of the drug of the drug. Okay, all right, I think we should be wrapping up. Any final words for our viewers, word of advice regarding this very topic? Anything for our ladies out there to look out for, what they should do and all that?
We mentioned the predisposing factors already, and sometimes we have this notion in our communities or our environment that when you put on weight, it means it means you're
fine.
I'm sorry,
it's a good living sign.
Weight gain is not a sign of good living. Is rather a sign of a disease, because obesity is one of our major problem in our societies. You know, obesity predisposes you to so many disease conditions: diabetes, hypertension, stroke, uterine fibroids, and all that. So I'm pleading. This one is a serious plea. I'm really pleading with each and every one of us that exercise should be one vital thing that we include in our daily activities. You don't necessarily have to just wear your jogging pants and then go out there to jog. No, just within the confines of your room, you can create your own gym area, you can create your own exercise area. There are so many of social media platforms that have this exercise sessions early at dawn. And for us who are in the Zongo community, since we wake up at dawn to pray, this is an opportunity for us to just join them and exercise. And also, let's be watchful of our diet. You know, currently I've realized that most of these diseases are very common, and the young ones are developing these chronic illnesses. But in those days, hardly someone will grow up to 80 years and hardly would you hear of any diabetes or hypertension. But currently, at the age of 30 years, a young guy is developing diabetes, a young guy is developing hypertension, kidney diseases, and all that. So let's be really watchful of our diet, exercise, and also general hygiene. General hygiene is very, very necessary. We always think, oh, wearing one dress twice is not a big deal. But then looking at our environment these days, when we look at the dust, when we look at even the microorganisms and the dustbins we have around that are not well disposed and all that. So I think these are some of the things that we really have to be conscious of, because the hospital wasn't meant for you to fall ill by force and come. It was only meant to help you when you are ill. But the most important thing is for you to create your healthy environment at home, so that you also relieve us of the pressure at the workplace, you know. So and we plead that over-the-counter medication is one thing we abuse a lot, especially the pain medication, the pain relievers. We end up buying our own diseases instead of using that to buy our own health. So let's use our money to buy our health affordably than to use our money to buy diseases expensively.
So
nice, this is what I have.
Thank you so much. If you could just switch over for us, since we are wrapping up.
Okay. So one other thing. Okay. The Hausa, you have to bear with me.
She speaks Fulani Hausa. I don't mind her. It will come out nicely.
You have to bear with me in the Hausa. Okay, I've been the kadan da nake so in faɗi shine lafiyar yana da muhimmanci. Saboda rashin lafiya ma na iya hana mutum ibada. So lafiyar mu yana da very important. Abincin mu yanzu cikin environment mu wani yayi jiki sha ce wallahi kin yi kyau saboda kin yi jiki, amma fadin gaskiya jiki ba shine lafiya. Jikin da muke yi na ciwo zalla ne. Isa mu yi kokari mu duba abincin mu da personal hygiene, tsaftan jikin mu, tsaftan abincin mu, tsaftan wurin kwana, tsaftan komin mu, because ko Allah ma na son abin tsafta. Isa yace muna mu yi alwala sannan mu yi sallah ko. So tsafta yana da muhimmanci. And kuma exercise ba dole bane ka sa kayan exercise ka fita waje ka je ka yi exercise. No, exercise ko cikin daki, no matter the size ko ya girman shi yake, mutum ya yi exercise shi kadan wuri. Akwai social media platforms da yawa da yanzu asuba 5 a.m. ana gwada exercise sessions. Ko cikin daki ma kin iya ko kaya ka bi su ka yi exercise. Ba dole bane ka fita waje ka je ka yi exercise ba. So kadan da nake da shi da dan kare ke. So we should be very conscious. Sorry about that, but we should be really conscious of our health. That's one more important thing.
Yeah, we should be. Thank you so much. Before we wrap up, we are still in October and it's still Breast Cancer Awareness Month. We urge all our women out there to engage in self-breast examinations. If you can't do it, let your partners help you in doing it. Better still, if not, both of you cannot do it, you can go to the nearest facility and get your breast checked. Breast health is very important, and we'll keep hammering on this until the end of October. All too soon, our time is up to end the program. You can join us same time next week at 4 p.m. To jamaa nanga za mudesa aya come program for Health Zone. Ubzo nanga kuma next week 4 p.m. inshallah same time. Salamu alaikum.